who's representing the World Association for Community Radio Broadcasters. Ladies and gentlemen, welcome. So just a few ground rules. May we kindly all mute our mics if we're not making any contribution. If you have any contribution to make, kindly raise your hand during the question and answer session, then I would recognize you. Without wasting any time, I now invite Franklin Hayes from South Africa to give us the first presentation. Franklin, over to you.
Thank you very much, Vivian, and welcome and good morning to everybody else, afternoon and evening for those in different parts of the world. My name is Franklin Hayes, and I'm in South Africa. I'm in Paarl, just a half an hour outside Cape Town. I'm from an organization called Com Radio, PTY. It's a company that provides services for and to the community radio sector. And I'm also here as an expert and an advisor to the National Community Radio Forum here in South Africa. And so I'm glad to make my contributions. If you look at community radio in a time of crisis, I've looked at a few highlights or headings that I've identified. I'm looking at the challenges, and there we can see the issue of sustainability. We're looking at the regulation compliance under those challenges. We're looking at safety of staff under those challenges. So I'm going to just fall away with some of those challenges, Vivian. So in terms of sustainability, we realize that resources, is a big problem, access to those resources, and that might have different permeations. In this case, we might have a loss of income through advertising that some stations might use, even sponsorships because of the lockdown regulations. People are not working and these businesses are closed. So we realized that in this time of crisis, there's a loss of income and opportunity to the community radio sector as a whole, and stations struggle. So procurement in terms of government communication procurement is also difficult to come by individual stations, and hence the need for national networks or forums to organize on behalf of a sector in a specific country. We're looking at the regulation and the compliance there. When you look at community radio that's regulated, like in the case of South Africa, we have regulation that clearly stipulates that we must have public engagement. There must be AGMs so that we can report back to constituencies or listeners within our footprint areas. There must be local content quotas in terms of our news bulletins. And so within the context of a pandemic like this, crisis like this, you are really challenged to comply with those measures because of access. You don't have access to these sources of content, and you have trouble in terms of organizing your the staff, your volunteers, because these volunteers use public transport to get to your station. So those are some of the challenges when it comes to regulatory compliance. It then becomes very difficult for these stations to ensure that they still comply with some of the normal regulatory measures. Hence, we will look at the role of the regulator later on. In terms of this crisis within the community broadcasting sector in South Africa. The third area that I want to raise as a challenge would be safety of staff. So we look at personal protection of our staff in our studios, access to our studios, people entering and exiting our studios. And so there's a need, and it's an increased cost if you look at how to secure and to sanitize these places of work for our staff and our volunteers. There's also the challenge of access, or rather transport, to the radio stations to come and do your work as a volunteer. And then also for news team and program producers to go out and to go access content locally. They then become exposed to possibly infection there. So I think that's critical measures when it comes to the safety of our premises, in our facilities and our staff. And then if we look at the role of the regulator in a time of crisis concerning community broadcasting, you look at ICASA, the Independent Communications Authority in South Africa. They've issued quite a lot of directives during this time. They've also issued an exemption in terms of the regulation. But you also understand that within South Africa, we have a forum, the National Community Radio Forum. So we will look at what was the role of the forum engaging ICASA in terms of loosening or becoming more flexible in terms of the regulation concerning community broadcasters. So there's one area for the regulator. It's to look at how do you loosen these regulatory regulatory measures to ensure that these broadcasters can continue under a crisis like COVID. So we're looking at the release of these directives or directions by the regulators. It would include, obviously, also how these broadcasters, not only community, but all broadcasters that are licensed, now take up the responsibility to broadcast public service announcement and all information regarding COVID-19. It was critical that this directive was, or directions was released, because it then assists in the combat of fake news. Okay, so we also look at the role of government, and in South Africa, the regulator is independent of government, and I put it independent of government, although still under the Ministry of Communication. So there is a measure of clear independence in terms of roles and responsibilities. So what would the government's role be apart from ICASA, the regulator? So we're looking at the Department of Communications, and what happened in South Africa is that the Department of Communications also released directions, or and those were those directions were meant to inform and to provide clear guidelines to the sector, to all broadcasters, looking at communication and infrastructure for communication within South Africa, and how that will be used to combat the COVID-19 pandemic in South Africa. And so those directions were clear in terms of how there will be extra frequency released by government through the regulator, and the regulator also issued the invitation to apply for these emergency frequencies, so that there would now be emergency channels, and these channels from a communication perspective would cover anything from education to community or public information. And so some of those frequencies were issued as well. Then the role of community radio networks like the National Community Radio Forum. I will make available some of these statements and documents afterwards through Vivian, but they also released press statements in terms of their role that they're playing. They are continuously negotiating with government to use the community radio stations and to ensure that they secure procurement opportunities for the sector as a collective, so the departments would then use them. There is a tendency, and I think here we move into the opportunities, is that in a time like this, there's an opportunity for us to fast track some of our advocacy means in terms of how do we communicate the importance of the role of community in a public education to create public value. So we've been able through the NCRF to ensure quite a few contracts with government to use and utilize community radio as a platform. For instance, education is doing regular programs to make sure that our students at home is up to date with the curriculum, and so we have curriculum experts in different subjects to communicate via the local community radio stations and TV as well. So I think, Vivian, I don't know how I'm doing in terms of time. There's two more areas that I want to just mention. It's the role of agencies, government agencies like the Media Development and Diversity Agency in South Africa. It's a funding agency specifically brought into life to support the development of the community radio and small commercial media sector. And they have been able to secure a budget to support the radio stations. And this budget was released in the form of about 45,000 Rand per broadcaster that applied to get this funding. And so they have been able to disburse some of this money. Most of the money in the first round was disbursed, or all of the money, and we're now busy negotiating through the National Community Radio Forum and other forums with MDDA and other structures of government to release more money in terms of support during this time for these community radio stations who obviously have lost income because of the pandemic. So the last area here would be the role of civil society. So we've seen that not in South Africa, but Southern Africa, there's been the COVID Forum that has constituted themselves. They have been in existence around this kind of support to governments in the SADC area, and have been able to lobby support in terms of how to fund public education, how to fund public education around testing, around just clean, healthy habits and so on. So there's definitely a role, and that role of civil society in terms of public education and on the ground contact with communities is also very critical. So yes, I think in a nutshell, I'm going to stop there. I have examples of all these things that I've mentioned, Vivian.
Thank you so much, Franklin. I wish to recognize the presence of the community radio chair, the UNESCO community radio chair, who joined this discussion. You are most welcome. Already he has posed a question on, if possibly you could give examples of the exact exemptions that ICASA has sort of like laid out. Yes, I know that he's leaving in about 45 minutes. I'm not sure if you can quickly respond to that, or you respond to it during the Q&A.
I can provide him with the actual documentation. It's public document. So I'll, Vanette, if it's possible, I'll give you my email. It's info@comradio.co.za. I'll put it in the text frame now so that we can communicate, and I can forward you that information as soon as we're done with this conversation.
Thank you.
Thank you. Thank you, Franklin. Also, I know that you made mention of a COVID-19 forum that has been formed in Southern Africa. If you can also share the contacts for that, because I'm sure others might not have heard about the forum. Now, moving on with the program, I now invite Maslin Nyambala, who's from Kenya, to share experiences from the Eastern region side of Africa. What gaps have you noted in terms of the reportage by community radio, and also support that you feel should go towards community radio as we are covering the COVID-19 pandemic? Maslin, over to you.
Yeah, thank you very much, Vivian. Just to say that community radio station being what it is, that it is an alternative avenue for communities to access information apart from the public and the commercial, and therefore it is expected that the communication is going to be very, very targeted and is able to be responsive to the needs, the information needs of different communities. And therefore, the whole need of them being in touch with the challenges, and we are seeing the challenges around COVID-19 being a lot of it, the story is a health story, is largely a health story, but however, it is not just a health story, it is an economic story. It is a story about financial accountability, and so we one of the challenges, and let me say that I'm Maslin Nyambala. I didn't introduce myself. I work for Association of Media Women in Kenya, And we have a project where we have been working with the Community Media Fund, which is about enhancing the skills of community journalists to report on financial literacy, financial accountability, transparency, and social justice issues. So, so we work with a number of community radio stations, but nonetheless, the feedback that I've gotten from my colleagues who are in the stations that we partner with is that the, the people who are skilled, because the community radio stations are employing volunteers. So for those who are slightly skilled, there's a lot of pressure on them working in the radio stations that they are in, because we don't have a lot of people who have been there who are skilled in health reporting. We don't have enough way are skilled in monitoring the funds that are coming in place. And so, but one opportunity, one saving grace that I've been told by my colleague from Pamoja is that they have been able to invite experts who have been able to expound on a lot of those information. So in terms of challenges that the community radio stations are facing, is because they are volunteers, a number of them, and because they're not trained as journalists, a number of them are not accredited with the Media Council of Kenya, which must accredit all the journalists, and similarly must accredit them as performing essential services, which would therefore allow them to work beyond the curfew hours. So because they don't have that accreditation, that has been a challenge to them from many perspectives, that working late. But it is also in terms of access to information, government briefings, daily government briefings on the data, on the statistics, on different issues that pertain the health ministry. So because of social distancing, the government has limited the number of people who can be able to go into the daily press conferences. And so quite a number of community radio journalists are affected by this, that they feel excluded because they targeted some main newspapers and main TV stations and expect that this should feed everybody else. And therefore, there is an opportunity for the community radio stations in Kenya to organize themselves, to be able to petition the government and lobby around their work so that they can have more access. There are issues of insecurity. One journalist was attacked by thugs in Kibera recently, and unfortunately he passed on. They tried to rob his laptop, and because he lives there and he knows them, he said, "I know you," and therefore, because thugs, once you say you know them, then they certainly are likely to take your life. So therefore, I see also an aspect about more security training around this time because of the vulnerabilities that may arise from working. Then there is the issue about misinformation. This is also related to skills, that a lot of fact checking is required around this time. But I saw that I talked to my colleague Tom Boyer, who told me that at KCOMNet, which brings together a number of stations, I was trying to get him whether he can be available to join this call as well. Is that they now have established a fact checking desk, and again, there is an opportunity for shared resources. How are we able to share resources? Use one desk, use several, at around a time like now when resources are scarce, there remains opportunities for shared resources such as fact checking, and I think that is a good opportunity. And then the need, they say they are very, very targeted and feel that after this they would really want to build the skills of their journalists in reporting health. And the issue also about pay comes in, that the feedback was that a lot of the adverts that were in place have become less and less. And of course, we are seeing where companies have scaled down, movement of money is slower. And therefore, a number of the people who are supporting them, adverts, programs, have gone down, and therefore, again, I think this has already equally been mentioned by Franklin, that these volunteers now do not have transport to there's a loss of the ability to be facilitated. And so again, there's an opportunity to just come together again and begin to lobby, because there is the COVID rapid responses that are going on, and it is about perhaps maybe uh, our colleague might talk about it as the umbrella association, about lobbying and seeing whether some of the stations can be held, because we ourselves had our forum on the World Press Freedom, and they said there are things that if certain things continue, then by the end of COVID-19, we may find ourselves having lost a lot of ground. So it's a time to try and collaborate in building resilience, lobbying. So there are funds, and maybe there might be need for skills for some of the station people, station managers, in grant writing, so that they're able to respond to some of the calls that they're able to do. So maybe Zoom calls to build their skills in some of these areas, and just lobbying. And so I think for me, I want uh, to leave it at that, and just emphasize capacity to ensure that most of the stations are sustained, the skills, the lobbying, and ensuring that the stations survive beyond the COVID-19. Thank you very much, Vivian.
Thank you so much, Maslin. I especially noted the point that you raised to say that the COVID-19 story is not just a health story, it's also a financial story. I also know that a lot of countries are getting donations when it comes to assistance of local communities. So maybe the question is also, what are we doing as community radios to ensure that there is tracking, transparency, and accountability of the donations that are being received either by governments or other parties within our local communities. I note that Tom has joined the discussion. So during the plenary session, I'll ask him to also add on to the points that you raised, in case there's any issue that he wants to emphasize. One of our panelists, Rose, is having challenges tuning into the discussion. So I'll quickly move to Francesco in the hope that Rose will be joining us before the end of the meeting. Francesco, there have been a lot of issues that have been raised by Marceline and also Franklin, especially looking at the challenges that community radios are facing, be it related to safety and security, issues around sustainability, issues around personal protection. As the World Association of Community Radio Broadcasters, what interventions have you formulated to try and safeguard community radios globally or within different regions? And also, what have you seen from the work that community radios are doing the world over in terms of the challenges that they are experiencing and how they've tried to also mitigate those challenges? Francesco, over to you.
Thank you, Vivian, and good morning to all of you. It is really a great pleasure for me to participate to this conversation today. Yes, indeed, as you said, a number of different problems have already been raised by my colleagues. The World Association of Community Radios is the worldwide umbrella organization gathering roughly 4,000 members in all the regions of the world, in Latin America, in Asia Pacific, in Africa, as well as in Europe. I think that community radios responded since the beginning very well. I've seen many initiatives in all the regions I mean, we can bring up some examples of, best practices, just like our colleagues in Bangladesh are doing. We also have many experiences here in Europe, but I believe that before talking about the experiences, we have to acknowledge the difference of our sector. So while the big UN agencies are doing efforts in order to provide information and toolkits, we have seen toolkits coming from UNESCO, of course, but also from UN Women, from the FAO. These are always messages that have to be adapted in a local context and especially in local languages. Of course, United Nations are working in the so-called official languages, mainly French, English, Spanish, but we know very well that in order to reach really the populations, to reach the communities, we need to use local languages. I think that one of the main problems raised this morning is again the same old story about the recognition, the full recognition of the community radio sector. Franklin raised the issue of the regulation, but before the regulation, we also need to have good legal frameworks in place. And these legal frameworks sometimes are not existing or are not enough in order to provide radio stations the possibility to have a truly impact towards the communities. In some countries, for instance, community radio stations are recognized, but in the meantime, they have a lot of limitations in terms of broadcasting power. If, of course, you have a broadcasting power very limited, your impact will be very limited. And therefore, the sustainability of these radio stations will be very limited. I believe that the main concept that was raised before is the concept of the public interest broadcasting. We have to have a common struggle in order to recognize the public interest of the community radio sector, of the local broadcasting, at the same conditions of other local, commercial, or public service broadcasters. It is incredible that until now, in some countries, we can have local commercial stations broadcasting with huge power, while the community stations cannot do the same. One of the things also that I heard very, very interesting is the issue, always related, I believe, the status.
You are usually telling the
Sorry? And it is the issue of access to information. Access to information is a key issue because, of course, when there is not access to information, what can be, let's say, effective.
but your voice is not clear, it's breaking.
Sorry?
Your voice is breaking.
I don't know. Yeah, I'm sorry, but it's a matter of connection, probably. The access to information is another key issue, and it is again related to the public interest of the community radio station. Without a truly access to information, it is difficult to act properly. And therefore, what we have is the proliferation of fake news and the proliferation of messages that are not coherent towards the communities. So it is also important in this case to re-put on the center of the issue the role of journalists, the role of our journalists and what they can do in order to overcome this fake news process. One of the things that we are experimenting in, especially in Europe, is the some new possible technologies and strong interaction between mobile telephony and traditional FM radio station. There are new technologies that provide now the possibility to interact with the radio station, creating programs, including these programs in a program schedule, having a feedback, and all this can be managed by a simple smartphone. All these programs can become a podcast online, can become a program to be broadcast on FM, but in the meantime can be spread over WhatsApp groups that reach directly the population on the ground. One of the things that we are trying to set up in this moment as a mark is a big program towards at least 200 or probably more radio stations around the world, and providing financial sustainability. We have to ask radio stations to produce themselves the programs, of course with some common guidelines, and this will provide financial sustainability and also recreate a kind of mechanism that can support the radio stations toward the communities. To broadcast the messages of the toolkits that we have in place right now, it's not enough. And on the other hand, before setting up this program, it would be good, I believe, to establish a preliminary study with few key countries where we can also measure the impact that these toolkits had so far. Was these toolkits good for radio station? Did they use it? How they use it? What's the needs that were not fulfilled? What worked and what worked not? This is an essential element of our reflection right now, because if we want to give an added value, we need also to understand what are the errors that we did so far and how we can overcome these errors. There is another issue raised by my colleague Franklin about the safety of staff. Of course, this is another concrete issue. But again, I think it is related to the big problem, which is again the issue of the recognition of the radio station and the recognition of the public interest that they are doing. Fact-checking costs. Marceline raised the issue of the fact-checking. I know that Tom is also involved in this process, Tom Boya, but fact-checking costs. And it's again a matter of resources and sustainability. So at the end of the day, I believe that all these experiences that are in place in the different countries are very spontaneous initiatives that sometimes have an impact, but sometimes cannot have an impact due to the limitations of our sector. And this is why I stress again the importance to act together at the national, international, regional level in order to recognize the role of the community radio stations. So I think that for now, I will leave the reflection to the other participants, but of course we can enter into details in order to see also what are these concrete experiences that are going on in the different regions. Thank you.
Thank you, Francesco, for that input and also the emphasis on, public journalism. Which ensures that information really gets to communities. Rose, I'll now invite you to speak to the topic before we get into the plenary session. Feel free to either type your questions on the chat platform or raise your hand, then I'll recognize you. Rose, kindly do your presentation, please.
Hello.
Yes, Rose, we can hear you. Welcome. It's good that you managed to join in.
Thank you very much. I'm so sorry. I had a problem with my smartphone, so please bear with me.
Not a problem. Please do go ahead with the presentation.
Okay, thank you so much. COVID-19 is the most unwelcome visitor in all nations globally. First of all, it came unexpectedly, and that the world was not prepared on the protocols of dealing with the COVID-19. It's just like AIDS. COVID-19 has wreaked havoc in people's lives, those who lost their loved ones, those who are grappling with the disease, after being infected and those who live in fear of being infected. Healthcare providers have had to cope with COVID-19 without having received any training on dealing with such an infection. There are no authorities in terms of protocols to refer to when providing healthcare. Because COVID-19 came unexpectedly, the world wasn't prepared in terms of policy and legislation. Each country has had to adapt in line with this environment and prevalent structures. For example, countries like the United Republic of Tanzania, with 65% of the population being engaged in informal sector, full lockdown wouldn't be people-friendly. So most of our people are mainly in subsistence economy, and the choice had to be made between full lockdown or half lockdown, while we take precautions and guard ourselves against infection from the coronavirus. Tanzania as a nation has had to apply the Infectious Disease Act and Quarantine Act in order to operate and fight against the coronavirus within legal parameters. We are lucky that we have the two legislations in place. Otherwise, people would refuse or would have refused to be quarantined and also to get tested for coronavirus. Tanzania has registered about 480 cases and 18 deaths. Among the dead souls are our fellow journalists. This created more fear and panic. Coming to the challenges, access to information is an essential part of the fight against COVID-19, yet journalists and media outlets who report on diseases are censored. There's controlled government information flow, lack of specialization in newsrooms, difficulties in accessing expert sources. Challenges also include dealing with misinformation. Resources to gather content by some media houses are still prevalent, but guides are working. We have had to grope in the dark, learning from the experience in other countries while building our own model of response towards the coronavirus. Our people are not used to social distancing. We are a nation of extended families and ties of kinship. We consider it rude. Hello.
What's this meeting about?
I beg your pardon?
What is this meeting about?
About pussy.
I beg your pardon, I don't get you properly.
That is Zoom bombing. I think they're just interfering in our meeting. Continue.
Oh, okay. Okay, thank you.
Yeah,
Sorry.
let the administrators deal with them.
Okay. So we consider it rude for us to use or see or not welcome people we love, our family and friends into our homes. We live in crowded spaces. Keeping social distancing is a major challenge. Public transport is also another challenge. Level seating is a new phenomenon to Tanzania for Tanzanians who rush to and from workplaces, as well as houses of worship, where we are used to being a faith community and shaking hands is part of worship. So operating these but few confines is a major challenge. There are also restrictions on the media. These restrictions have prevented journalists from the media accessing reliable information and production of independent facts. Lack of protective gears pose a threat to safety of journalists. Fear of being infected among the journalists in reaching out professionals in the community is yet another. Lack of professional knowledge and appropriate equipment like boom microphones oblige journalists not to observe distancing. Journalists use voice recorders and smartphones, holding them close to the mouth of sources during interviews, posing threat to infection. Also difficult in providing special education to special groups of people with visual impairment, hearing about its partners whose stations due to poor economic status during corona explosion. Another challenge is budget. Most of community radios are still struggling to be financially sustainable. Reaching out to remote areas to interview people with COVID-19 was a challenge. But we had our own strengths. Because we started public education early, it was easier to inform public about the coronavirus. But we first believed it wouldn't reach our shores. Then we believed Africans cannot get infected with the coronavirus. It was until we heard about the first case of a woman in Arusha, then it hit us that we are not exempt from infection from the coronavirus, nor are we immune. The media, the Western media has sensationalized the COVID-19. Images of dead bodies in plastic bags, gory narratives of dead bodies lying rotting, and the updates of death tolls. Italy started the mode of daily updates of on the number of death rates and the rates of infection. Britain and the US followed with the daily updates, most disconcerting and frightening. Word in the streets was, if we are going to die, why bother to take precautions? Now, what were the lessons learned? As I said before, nobody knew COVID-19 was coming our way. It was sudden and had many challenges. The media was caught unaware and were not prepared. Everything was like a storm which caused panic to the government, media, and general public. People from all walks of life need to come together as a nation despite political differences behind. So journalists are at risk of contacting the virus through direct contact with the community anytime. And at this point of time, digital media plays a very big role as a means of communication compared to traditional media, although internet in some instances is a challenge. Provision of proper, accurate knowledge and skills to enhance effective wider coverage on how to mitigate COVID-19 with educative messages. Practitioners need to be careful and professionally taking into account legislative, regulatory, and professional authorities when dealing with pandemics to avoid misunderstandings, fake news, and disinformation. Logistics and other support are needed for all those involved in dealing with pandemics in order to be able to cope effectively. It is also important providing timely information in getting the various groups of communities involved in tackling COVID-19 or other related problems. Joint forces and strategies among communities, institutions, individuals, and authorities, nationally and internationally, are needed to strengthen the government initiatives to deal with the pandemic. What is the recommendation and way forward? Strategic information delivery is needed in this war against COVID. The institution is given the mandate to inform the public about how we are faring in the war, or to be strategic. First of all, we need to deliver the good news first. Then the encouraging news. Then follows the sad news. The rest in peace then follows next. Each war needs a different perspective and approach. No one strategy would work for different diseases. We learn as we continue to fight all the time, clutching at straws, anything to give us hope. In this instance, morale is most important. Wars and battles have been won or lost just on the basis of morale. So our role as media practitioners is to inform the public in the sensitive manner, taking into account that fear breeds uncertainty, and uncertainty breeds symptomatic diseases like high blood pressure, totally separate from COVID-19. I'd say we should have social responsibility as media practitioners in the way we inform our audiences on the coronavirus in our duty to build morale. Thank you so much.
Thank you, Rose, for that very detailed presentation, and also including recommendations on the way forward, and also the emphasis on the need for countries to develop country-specific interventions to address the challenges that we are encountering. We will now move to the question and answer session, and allow me to open the floor and also recognize the Prime Minister of Pakistan, who has joined us. I note that he has indicated that he wants to make a contribution. So yeah, over to you. Please do make your contribution, and the question, feel free to direct it to any one of the panelists. Colleagues, the floor is open for questions and comments. Please do feel free to pause any. Prime Minister, over to you.
Thank you. Can you listen me?
Yes, we can. Not now anymore. Hello?
Okay, hi. I was lost there for a while.
Hello? Hello?
Yes, we are here, but I'm just looking. Vivian, can you hear us?
Yes, I can hear you.
Okay.
I think that the Prime Minister of Pakistan wanted to add few elements of reflection to our conversation, but I'm not sure if the connection is good enough or if there is any problem, because I can't hear his voice any longer.
Okay, so I'll just quickly go through some of the comments that came through the chat platform. We have a contribution from Tariro, who highlighted that the risk to infection for journalists is so real, yet journalists are hardly considered as frontline workers. I think this also fits into the recommendation that there is need to provide personal protective equipment to journalists so that their well-being and health is safeguarded against contracting the virus. I also recognize participants from other countries that joined, from Uganda, from Namibia. You are most welcome, colleagues. I'm not sure at this point in time if there are any other questions that I might have missed. But if you have any question, please feel free to raise your hand, and we will definitely recognize your hand so that you put forward your input. Tom, sorry, before I come to you, Tom, Patricia, feel free to make your contribution. Hello, Patricia. Tom, earlier on, Maslin in her presentation indicated that there are interventions that you have made to try and protect the interests of community media broadcasters in Kenya. Care to share and expand on some of the points that you feel will be beneficial to some of us, including our panelists?
Hello.
Yes, hi, we can hear you. Please go ahead.
Yes, I'm glad to be here with this meeting. I'm happy to see Francesco. It's a long time, man. And Vivi, again, I'm happy. A lot is happening, and just like Mwalimu has said, these unwelcome visitors brought about many issues. But back to the question that you've asked in terms of what Marceline said, you realize that a lot of challenges, community radio stations in Kenya are faced by a lot of challenges. And one of them is the question of the social distancing or physical distancing as it may be. And you realize that most of these stations are working in a confined small environment, and therefore it's a challenge now when you talk of a number of people who are supposed to be at a given place at a particular time, given the 1.5 or 1 meter physical distancing. Then it becomes a big challenge to the community radio stations, because they are working from small spaces or small rooms, and therefore that is a big challenge. So what we've done at Kenya Community Media Network in terms of realizing that, and also given the fact that the question of COVID-19 is a global pandemic, then we manage now to get some production going on from our end on COVID-19 and give this content to the stations to air. Of course, we've also managed to raise and get some support from some other organization who are now putting in something to help the stations to air this content. And that is a big plus to the stations. On the question of fact checking, we've also having a team that fact checking desk that is doing the fact checking for the station, because we realize that most of these stations have got a limitation when it comes to accessing the internet, because some of them are in the areas where even the internet is not stable, and therefore it takes time for them to get the correct information and all that. And also, given the fact that there is a lot of information, misinformation going on in the social media platforms and all that. So what we are saying is we are providing a platform for the community radio stations to put a question or send us what they want to be verified. And the team at the Kenya Community Media Network will do the fact checking. Team will do the fact check and give them feedback in terms of the correct information that they're supposed to put forward to the public. The question of equipments, just like has been said, I agree totally with Mwalimu, because most of these stations depend on their phones to do recording, and a few who have got the hand recorders would use the digital recorders. But some of them, majority of them, use their phones to do recording, and it's a big challenge. The other thing is the limitation of the number of people who can attend the briefing, the government briefing. And here in Kenya, it's somehow we are witnessing a trend whereby it's only like 4 or 5 radio stations or media houses who are allowed to send people for the briefing, and therefore the rest of us will connect or link, and those who are not able to link then may not have the information, and therefore that also is a bridge, is a gap that KCOMNET is trying to bridge. So I generally agree with what the panelists have said, and probably that is what I thought it was important to add. And probably the other thing which I must say from Francesco's presentation, the question of limited coverage area, they have got small area. And I think that is what even the advert, the media, the advert buying agencies are using to deny the community radios revenues. And to me, I think it should not be used, because even that small number that the community radios are having is a niche, is their niche, and that is also a population that is supposed to be served or is supposed to get a particular information or service. So that should not, in my view, should not be used as an excuse to deny the community radios revenue in terms of what they can be able to do in form of the social advice, advertising or announcement that may occur. And what we are witnessing now in Kenya is that almost each and every organization would like to do an information or a public service announcement on COVID, and they are rushing to community radio stations for free airtime. But when they have got business, they are denying the community radio business, saying, what is your reach? What is your reach? They are using that to deny the community radio stations an opportunity to get money. But now They want time, they rush the community radio stations. That is where now they are going. They think they'll get the time or airspace easily. And I think this is something we need to continue discussing and making those people to understand that even if our reach is only 5,000 people, that is a niche that should also benefit from whatever service that you want to provide. The question also in terms of the question of protective gears, that is also a challenge, because you realize that most of these community radios depend on community volunteers. And some of these community volunteers can only volunteer their hours, like 2 hours or 1 hour to the station, and then go to their usual activities. They are not employees as such. And now asking them also probably to get some of these protective gears when going to get information and all that is becoming a big challenge. And the question of transport, like Mwalimu has said, it's also the same here in Kenya. So these are things that are affecting our community journalists. And I will end by expressing our condolences to the Pamoja community radio station, who lost their journalist during the World Press Freedom Day. He was attacked while he was from duty, and we really condemn that. And that simply tells you how vulnerable the community journalists are when it comes to personal security, because these are people in the community, within the community, and if there is anyone who do not agree with them, then they become very easily targeted, and then they become easy prey, because there are people who are known within the communities. They are always there. They are within that particular community. So back to you, Vivian.
Thank you so much, Tom, for that contribution and also adding further detail to what Marceline had said. I'll quickly run through the questions on the chat platform. Francesco, I'll direct these questions to you. There is a question on how journalists can apply for help from experts or organizations that can assist community media. How can community media go about asking or requesting for support to try and address some of the challenges that they've been encountering? The other question is on if in your engagements with other world bodies, you have discussed issues related to why organizations such as WHO are not funding community radios to directly send out messages and cover messages, yet media is an essential part of the fight against the COVID-19 pandemic. I'm not sure if you're able to take up those questions, Francesco.
Okay. Yeah. First of all, I would like to say that I agree with Tom. Even if there is a small coverage, the importance remains the same. I didn't want to mean that there is less importance. On the other hand, we know very well that this is also related to the overall sustainability issue that you just raised. When community radio stations are less relevant, nobody cares about them. Suddenly, when big agencies or other media or other actors on the ground realize their importance, they rush to us, and they also pretend to have free airtime, so, which is always the same contradiction. I believe that to respond to the first question, there are, in this moment, there are a lot of cooperation agencies that are interested to support our sector. I see there a big problem. Sometimes these cooperation agencies have in place strategic agreements with other big NGOs. I'm not going to mention any, but there are some big NGOs around the world that are somehow consuming a lot of resources, and sometimes these big NGOs have also difficulties to redistribute the resources in order to increase the impact and increase the effectiveness of the actions. Therefore, I think that we need really to bring together our efforts and identify cooperation agencies open to this discussion. We are now almost out of the phase 1. We have two, in some countries it is over, in some other countries it's going to come, but in some countries we are already in a kind of phase 2 of the response. And the phase 2 should be a more long-term response to all these issues. Sustainable development, media education, food security, environment. All these topics are all related to the response that we are doing in an urgent phase for the COVID-19. So I think that we have also to be able to identify country by country, case by case, in which step we are in this. Because this can also be an important approach and a different approach of our sector towards these cooperation agencies. We know very well that the Swiss cooperation is keen to support the sector, the Canadian cooperation, the Swedish cooperation. There are many national cooperation. United Nations sometimes are even less rich than the national cooperation mechanisms and agencies. But we have to identify very clearly in which stage we are, case by case, in which direction we want to go and how to frame our proposal, especially in a long-term perspective. Also because this crisis demonstrates that the community sector is fundamental, and probably besides or behind the COVID-19, in the coming years, we will have to face two other urgencies. So I see two problems on that. Some big NGOs consuming a lot of resources because of strategic agreements already in place with cooperation agencies. The difficulty also of these NGOs to deal concretely on the ground. And for us, the possibility to act with a different approach. I'm not talking just about Africa. I see this also in Latin America. I see this in Middle East. In the MENA region, I see this slightly less, but probably the same problem in Asia Pacific. Therefore, it's not just an African issue. I think it's a worldwide issue. I don't remember very well the second question, Viviane. Viviane? Hello, hello? Yeah, I see another.
The other question was on PPEs. How can journalists go about requesting for PPEs?
For, sorry?
Personal protective equipment, personal protective wear, because it's a challenge in most regions where journalists are exposed to contraction of the virus because they don't have the necessary protective wear. So the question was, how can journalists go about, asking or requesting for such assistance? And are there any organizations that are willing to support such interventions?
I believe that this one is one of the issues also related to the programs that we have to put in place, how a long-term program can also consider equipment. Unfortunately, these mechanisms of the cooperation are very, very strict. So sometimes they very hardly available in order to provide new equipment. What I was saying before in relation to the new technologies, we are experimenting right now a technology called RUTIO. I will share the links with all of you, with all the information. And this technology provides the possibility really to put in place a kind of studio-less radio station. Meaning that once we have in place an antenna and a transmitter, everything can be managed through simple smartphones, which can increase the governance of the radio, because of course you can use it also for the governance of the radio, but can also increase, the participation of people, because sometimes it's much more easy to record a message on WhatsApp and to spread it around rather than go to the studio, record, make the production, post-production, etc. There is another very interesting technology that we are experimenting right now, and it is the use of the so-called TTS in radio station. TTS is the text-to-speech technology. Text-to-speech technology can be very, very interesting, of course, not in order to substitute the radio producers, but as an auxiliary measure to put on air some public interest messages where there is no time to do it. So if we receive a bulletin from the health ministry, or even a weather forecast, or even very simple, information, these technologies provide the possibility to adapt it and to put it on air without a human intervention. And this is, of course, a decrease of the efforts of the radio station. Again, it will never substitute the human presence. It is just an auxiliary measure, an auxiliary tool that can be used, especially in these particular situations. I don't know if I have answered to all the questions, but of course, feel free to ask more.
Okay, thank you, Francesco, for that. I recognize Victor Juma. Please go ahead with your question. Victor?
Yes, thank you so much. Can you hear me?
Yes, we can hear you. Please go ahead with your question or point for clarification.
Yes. I just want to pick from where Mr. Tom had left with regards to how community radio stations are going through so many challenges in Kenya. It is true what Mr. Mboya has said, because it's when it comes to our community work, community radio stations are always vocal because we serve certain audience within our areas of jurisdiction. It becomes a challenge, especially in access to information from the Ministry of Health, especially from the county government. We found out that cases are emerging from Kajiado, for instance, in Kajiado County, where I come from. And when you try to access this information by asking questions to the ministry, it's become a quagmire. It's become a challenge for the ministry to respond immediately. Because you see, yesterday, 2 cases were identified in Kajiado County, one from Namanga and another one from Kajiado Town. So our reporter went up to the Ministry of Health in Kajiado to access information. But again, it becomes a challenge for the reporters coming from local community radios to access information. I don't know if the county government, especially the Ministry of Health, is looking at community radio stations as small media houses, which to me should not be the case from the word go. 2, Tom talked about when business opportunities are identified, community radio stations are not considered, which is very true, because you find out that when these people, they want to do free adverts or even just free information out there, community radio stations will be their stopover. But when it comes to like paying for airtime or paying for advertisement, it becomes a quagmire, because now they look down to us as small media. So how can we address this issue of looking at community radio stations as a small media houses? Thank you.
Thank you, Victor, for that contribution. I'm not sure if anyone would want to react to what Victor said, but I will quickly read out
Vivian?
2 questions. Yes, John?
Thank you for this engagement. I have a comment, and
Yes.
it more or less relates to what Tom and Victor have said. We've worked with them within the community media space here in Kenya, and I always empathize with what community radios go through, and it's the same thing that I try as much as possible to tell the partners we work with and even colleagues at work, that the assumption that community radios don't have content is wrong. So in any intervention that someone plans, they think that now community radios don't have content. Let us give them this so that they can do it for us for free. They don't have content. Because one, these are not-for-profit entities, and they work within very tough environments. And it would be prudent, even within the networks, to just come up with the modality of how would you respond to such requests, whereby people just wake up one day and see, oh, community radios are relevant to support us within this cause. One, you must, I think, from my side, I think one thing community radios have to ensure is know when to say no. Because recently when I was discussing with some of the stakeholders here in Kenya, Victor being one of them, it's really, at times, it's very difficult to send, to say no to a partner that you feel you would possibly continue engaging with. But now this same thing, this same hand and goodwill is constantly abused. So I think within the networks, how can the community radios come together and find a modality whereby if we are supporting you in this intervention, what are we benefiting from this engagement? And I think it's time also to have discussions with the stakeholders whom the community radios constantly engage with, so that they know that, of course, it's a community radio, it's a not-for-profit entity, but that does not mean that now you can just channel all your interventions without even paying. Because some of the radios, at times when they reach out to us, UNESCO here in Nairobi, they say, we get very good requests, but when you ask, can we get some facilitation fee for even our journalists to come and attend or prepare a bulletin or an advertisement for what you want to be broadcasted within our radio station, they say they don't have. They'll easily have money to pay consultants to do their work. So I think these double standards needs to be clearly debunked. And I think the networks, Tom and team, Kevin and others, and other community radio networks, it's time that you come together and ensure that, of course, we will help, but you also need to appreciate the work that we do. Because apparently what I see in Kenya, it's very easy to pay the commercial radio stations to run an advert, but people will say a lot of things when it comes to community radios. Oh, we don't have money, or it's a community radio, they need to. But
Okay,
when it
Fabian?
comes to running an advert or supporting other interventions in mainstream media, people will always get money. I think it's important that Tom and the stakeholders to pick up this conversation and clearly define the boundaries of when can we partner. It should be a win-win, where your own radio station benefits so that you're also sustainable. In Kenya, we've seen some of the community radios just dying off because they were just doing it's sort of a charity work, free until journalists who are there left. They don't have money for things like recorders and other basic things, which I think it's unfair. Thank you, Vivian.
Okay, Vivian.
Thank you, John, for the contribution.
Vivian.
Yes.
Okay, I want to add to what John was saying, just in response
Sorry,
in my presentation.
before that, Franklin, there's a question that
Yeah.
I wanted to pose to you, which was raised by Anthony and also Charles, that when is the right time to request for assistance from the government? You spoke about the interventions that ICASA and MGDA have put forward for community media and the exemptions that are there. So the question is, when is it the right time for community media to request for assistance, and any pointers in terms of how we can better package those requests so that the first response from government is not no?
I think it's an ongoing process. It is really related to the role of a network. I think it was raised by John now, but it's so imperative that we understand that we need to have advocacy work on an ongoing basis. It's a role that we as individual practitioners must have, in our nature. It's to do advocacy in terms of the role that this radio is playing. It's ongoing, but that role, that advocacy role, need to be professionalized, need to be taken to the next level. So you need to draft a strategy, you need to have an advocacy strategy. So in the case of Kenya, you hear what John is identifying, that these different networks are going through. It will never stop, it will always be there, but it's our response towards that as a sector. So we need to develop a much more strategic approach in terms of developing strategies for advocacy. In the case of South Africa, we have the National Community Radio Forum, we have ZACRA, we have the International Forum for Religious Broadcasters, we have the the Islamic Forum for Broadcasters. So there are different permeations, different forums where people associate because of different interests, but eventually your role as a network would be to develop strategy to advocate for the interest of those members, if you are member-based, or those stations that subscribe to the set of values that you have developed. So I think critical is, when do you then engage government for funding? If you do not have this strategy in place, then you are vulnerable, because you have not set apart yourself in terms of principles of engagement. So you need to protect your independence as a sector. That's the purpose for community radio. It's to be independent, to be the voice of the voiceless. And so that critical policy, you need to have a policy on the independence of your members, of your radio stations, of your structure in terms of how you engage government. So in the case of South Africa, there's clear 3-tier broadcasting system. It's enshrined within the constitution, it's enshrined within the different policy directives. So it's very clear that there should be a apolitical approach, number one, and it should be in the interest of the public. So those are imperatives.
Hello, Franklin? Franklin?
Yes, yes. Okay, we have this Dennis brew that's disrupting us. Can you hear me?
Yes, we can.
So I was saying that it is so important that we as a sector within countries where we are, that we take it upon ourselves to start organizing our response. Firstly, you need to have a clear principle in terms of that engagement. Number one is there's a component of independence that need to be protected. Number two, there's an imperative of public interest that you as a sector, as a community radio is addressing. So you are providing public value. So this public value that you do through your content and your coverage of local content is always got a development slant. So there's a development social impact focus that we have as radio. So as soon as we can articulate ourselves around those, that becomes the basis of our framework, our what I would say advocacy framework. So if we can develop that advocacy framework, then we can start developing a clear agenda in terms of how do we engage. And it's going to be wave upon wave upon wave. It's never going to stop. We need to take it upon ourselves to make sure that we are very much constructed into an organized forum, association, or just a position in terms of a collective of stations. And then we need to start providing that kind of guidelines and leadership. So with government in South Africa, for lastly, Vivian, how we've engaged government was that government also have an interest to communicate to the public, and they do recognize the role of networks. And so they have approached these networks to say, as NCRF, we want to support the community radio sector. How do we start to do that? And so that engagement assisted a safety framework for that engagement. So I think that's also important, back to the role of your networks and your associations at country level. In South Africa, we also engage on a provincial level. So you have provincial structures. So you have the NCRF national, but you also have 9 sub-provincial structures. Some of them are very successful. Others are struggling to come into operation. But yeah, that is the gist of it.
Okay, thank you, Franklin. Alamin, please do make your contribution. We are now left with 10 minutes. Sorry, we are now left with 10
okay.
minutes.
I'll be very brief and quick. I know we don't have enough time. Yeah, I have a few contributions. One is on the niche of or the importance of community radios. I know some of our colleagues, especially from Kenya, pointed to the fact that community radios, stakeholders want community radios to provide airtime for free when they need them, but such statements. Now, I'd like to say that community radios, if you look at all the tiers of the media, they are the most closest to the citizen. And I think that is a very good selling point for community radio stations. One, for better messaging, but also for use of local languages, especially in the current situation. I think you have seen with COVID-19, it's all about behavior change. Social distancing, physical distancing, hygiene practices. It's all about behavior change. And I think we, as community radio practitioners, should take this as a selling point for community radio stations. So the question here is, how can we turn this narrative of community radios being seen as having very low coverage to a selling point to say that, look, we are the appropriate channels to address the issue of COVID-19. So that's my first point. But second is this proximity of community radio stations to the citizens also brings another challenge, and that is trauma. Community radio stations are much closer to the citizens. They are open to the public compared to other tiers of the media. So they are more in touch with the average citizen. They address issues or cases of the citizens that they know even by name. It's about the neighbor, it's about someone living in the next street. So there is a probability that community radio practitioners may go through trauma through this COVID-19 pandemic. So I think this is one area we have to look on psychosocial support for community radio practitioners. That brings me now to another issue which was raised. I try to be brief as well, on how can community radios operate in case of infections, which is a big challenge because community radios have got very few members of staff, very limited infrastructure, and the likelihood of infections is much higher. So the question here is, how can we work to ensure that we have business continuity plans with community radios, especially business continuity plans which are focused on this pandemic? So I'm throwing this as a challenge, and maybe this could be one of the takeaways from this meeting, that how can we come up with a business continuity plan for community radios to address not only COVID-19, but also several other disasters. We have seen natural disasters, for instance. In Southern Africa, we have had the challenges of Cyclone Idai. Now, how can we come up with these business continuity plans? And finally, there was the issue which was raised on use of mobile technologies, actually the advantage of using mobile technologies. I'd like to contribute also by saying that community radios have the tools. Most of you have got smartphones.
Hello.
And
hello.
That's Zoom bombing again. So yeah, let me continue. So yeah. I'd like to give you one example. For instance, there is a tool which many community radios don't use, and that is Telegram channels. It's a very straightforward way of opening up a channel and sending messages to so many citizens. So this is just one example of how community radios can reorient themselves and move to mobile technologies in the future. And anyway, let me end up here because we have very limited time. Thank you very much.
Just very shortly, I believe that exactly the point that I was raising. Also because radio is changing. Sorry?
It's okay, you can continue.
Sorry, continue, yeah.
Yeah, I mean,
It's
what I was
bonus.
saying is that I totally agree with you. It was exactly the point that I was raising. Radio is changing, and we have to change accordingly. So one single format can be used in several different platforms, and this is how I believe we have to reconsider the role of our radio stations and the role of the participants to this community.
My asshole smells weird.
Thank you, Francesco, for that addition. It's now 12:35, and I'll quickly read two questions and brief responses, please, to the questions so that we wind up. Rose, are you still with us? Hello, Rose? Okay, I'm not sure if any of the panelists can take up this question. Radios want to respond to questions from local communities, e.g. myths and technologies in COVID-19 and how it is affecting them. But regulators and ministries of health only want their general messages aired. How do you reconcile this misunderstanding? E.g. in Tanzania, government has stopped releasing tracking data for 4 days, yet their neighbors are getting cases coming from Tanzania to Uganda. How do you cover that countries who are positive? And then the other question is coming from Anna. Hi everyone, I'm a Finnish NGO help. My question is, a lot of literature is recommending that need to do the following. Where health and other response systems are no longer accessible or are focused on the COVID-19 response, develop channels for virtual consultations, for example, through helplines, radio, and mobile phones. In Tanzania, we have the government 199 hotline and the 166 National Child Helpline. In my work with the latter, I found a lot of rural communities are not aware of this service, yet it could clearly help there. How are community radios engaging with these helplines? What more could be done to strengthen the link? So 2 questions. I'm not sure if any of our panelists can take up any one of them or both.
Perhaps I take the last one and
Thank
say
you,
that, yeah, basically the over-reliance on mainstream media and also social media. We are finding, even for us now, we are here on this platform, basically more online platform, and we have a lot going on, public service announcements in the media stations, television stations, the mainstream. But like has been said here, you find that very many the community radio stations are in touch with the community. And even if not directly, but when somebody in the community hears, the diffusion of information, then they're able to share with community members. So this, the free toll lines, including those, we've talked a lot about gender, but even gender-based violence, we are seeing a lot of it. We are seeing a lot of it occurring at such a moment, and we have the toll-free lines. So I feel that community radio stations are able to play a big role in disseminating. It needs to be intentional that they communicate these numbers. But I just wanted to still weigh in on the financial sustainability, where definitely there is a value, because if organizations and individuals can recognize that I have this message, and I feel that if I give it to the community radio stations, then they're able to disseminate it. I think it is from there that the community radio stations and me being a person of interest, a partner in this area, this is the place where we should pick up the issue from, that there is value that is beneficial to the communities. And I look at it as the way forward is looking for strategic partnerships. And I always say strategic partnership means us beginning to develop concepts together. And I already, for us at Amwic, from time to time, we have a budget line to our media partners. Much as we do trainings, from time to time, whenever it is possible, we have a small budget line that we will produce this program or we will produce these messages, and we are able to support even some allowance to the radio host. We are able to try our best to put money in the hands of the community radio stations that we work with as much as it is possible with us. So for the way forward, I think we need to explore those partnerships. John Okande is here, UNESCO. I think that is a very good place for Tom and even the team in Kenya to start from and see what is it that we can do. And I feel that the COVID-19 offers an opportunity to bring greater recognition and is just to get the voice heard that we are here, we offer this value, and we want the COVID response to include us as well. Thank you very much.
Thank you, Marceline, for that contribution. We are now way over our time. So Francesco or Franklin, any one of you to respond to the other question before we wrap things up?
Just to clear, what is the other question shortly?
Marceline responded to the one on the hotline. Let me look for the other one. Oh my goodness. Okay, maybe if you can then type in I'll then type in the comment section. Sorry.
Okay, now I think it was around the
Okay,
thought.
how do you reconcile the fact that the governments at times are not releasing timeous information to enable broadcasters to distribute information, and then you find that in other countries it is being done timeously? So how do you balance the two between what is happening in your country and what is happening in the neighboring country?
Yeah, I think there's some examples, especially by AMAC Asia Pacific, how they have been able to provide information, access to reliable information through the network by advising, international sites and localizing that content for their region, sub-region, and country. So there are ways, but individual stations normally or sometimes don't have that resource in terms of bandwidth, internet access, and capacity, skill, or even just bodies to be able to do that. And I think it's going to be problematic, but it is possible to circumvent or to come around some of these barriers within local countries. That's the last I think I can contribute, is to say that networks, associations, forums for community radio, they also play a role, like in the case of Asia Pacific, to assist with providing information, trustworthy information.
Okay, thank you so much, Franklin. I'll now invite Alamin to give us the closing remarks. Alamin, if you have any additions or something that you want to emphasize, please feel free to do so before I bring the meeting to an end.
No, Vivian, I think we are well beyond time, but maybe I'd like just to thank everybody who participated in this very interesting webinar. I know you had very important issues to attend, but you dedicated your time for this noble cause. So thank you very much. And we at UNESCO really appreciate your support and collaboration. Very briefly, I'd like to say that this is an initiative which is being led by UNESCO to try to bring collaboration between community radios in Eastern and Southern Africa to address COVID-19, but also we'll also try to see if we can continue with this collaboration in the future to address sustainable development goals. So for us, this is just a beginning, and I think it was a very good beginning. So thank you very much once again, and thanks a lot, ZACRAS, for organizing this. We look forward to further collaboration. Thank you.
Thank you, Alamin, for that. Allow me to also thank our panelists for making time to share experiences from their countries as we tackle COVID-19. I do hope that you still avail yourself for future engagements. And many thanks also to all participants who found time to attend this discussion. I'll now read out Irene's McKenney contribution, which clearly sums up this discussion. Thank you all, the panelists and all who shared experiences. I came to understand we have similar challenges across the regions. Thank you, Irene, for that. And thank you, colleagues. That brings to the end our Zoom discussion on COVID-19. I do hope that we'll interface and interact in other platforms. Thank you, colleagues, and good day.
Thank you very much, Vivian, and thanks everybody. It was a great discussion. We have work to do together.
Yeah,
I hope,
true.
Vivian, you can share some of the contacts with us.
Yes, I'll do that.
Okay, thank you very much.
Thank you for the opportunity.
Thank you. Bye.
Bye-bye.
Thank you. Bye.
Asante, kwaheri.
Kwaheri, asante.